Hello everyone, and welcome to Ready, Set, Go, a webinar series sponsored by HUD's Office of Special Needs Assistance Programs, known as SNAPS. My name is John McGaugh from the National Center on Family Homelessness and the Collaborative Partnership, and I'll be introducing today's webinar. On behalf of SNAPS, I'd like to thank all of you for joining us. Today's webinar is Building Community Partnerships to Effectively Serve Veterans Experiencing Chronic Homelessness through HUD Vash. Next slide, please. Before we begin, a few announcements. First, this webinar is produced in conjunction with the HUD SNAPS Ready, Set, Go series. Also, today's webinar will last approximately 90 minutes. A recording of this webinar and the PowerPoint presentation will be posted on HUD's webpage for HUD Vash, the link of which is provided on this slide. Immediately following the webinar, you will receive a brief webinar evaluation by email. Please do respond to this evaluation so we can get your thoughts on future presentations. Next slide, please. If you have a question for any of the presenters, please use the questions box in the GoToWebinar toolbar. And if you have a question that is not answered during the webinar, you can ask your local HUD field office or VA Network Homeless Coordinator. If you do submit a question to either of those folks, please do reference this presentation titled, again, Building Community Partnerships to Effectively Serve Veterans Experiencing Chronic Homelessness through HUD Vash. Next slide, please. And now I'd like to walk through the agenda for today's webinar. We'll begin with the topic looking at the importance of community partnerships for ending veteran homelessness and serving chronically homeless. And our featured speaker for that section will be Nancy Campbell, the VA National Director of HUD Vash. Next, we'll look at HUD Vash and chronic homelessness, and our presenter will be Ann Oliva, the HUD Deputy Assistant Secretary of Special Needs Programs. That will be followed by What are CoCs and why are they important to HUD Vash, featuring the presenter Linda Charas, HUD Office of Special Needs Programs. And that will be followed by a number of questions from attendees listening to today's webinar. After that, we'll hear from the field and some success stories with teams of speakers from Atlanta, Houston, and New Orleans. And lastly, that will be followed up by additional questions at the end of the webinar. And now I'd like to turn this over to Caitlin Miller, the Housing Program Specialist at HUD. And with that, I'll give it to you, Caitlin.
Thanks, John. And I just want to make a couple of clarifications. One is that this webinar is produced in conjunction with the SNAP series, but it's been organized by under the Office of Public and Indian Housing in the Voucher Office at HUD, which we're the ones that do run the HUD Vash program, but we are very fortunate to partner with the SNAPS office in homeless programs at HUD. And the webinar may be posted on the HUD HRE website, but it will also be posted on the HUD Vash website, and the link is in one of those first slides that John scrolled through. So anyways, I just want to thank everyone for joining us today. I'm really excited about this webinar, mostly due to the awesome people we have as presenters that will be sharing their knowledge and experiences with us today. Since the revival of HUD Vash in 2008, we've increasingly become aware of the challenges of serving veterans experiencing chronic homelessness, as well as the importance of community partnerships for addressing and overcoming these challenges. So we've decided to have this webinar to emphasize the importance of what you're all doing as VA case managers, PHA staff, and community providers to serve our most chronically homeless, vulnerable veterans. We also wanted to spread the word about the lessons learned by local HUD Vash programs that are tackling common challenges you all face through strengthened partnerships with Continuums of Care, community leaders, service providers, and other important stakeholders. So now, taking a look at this agenda, we will start off today with my friend and colleague at the Department of Veterans Affairs, Nancy Campbell, who is the VA's director of the HUD Vash program. She'll give us an overview of our approach to serving chronically homeless under HUD Vash and the importance of community partnerships for doing so. Next, we are honored to have with us Ann Oliva, who is HUD's Acting Deputy Assistant Secretary of Special Needs Programs, which is the office that oversees most of the homeless programs at HUD. Ann will be offering some motivational words on serving chronically homeless veterans through HUD Vash. Next, my partner in crime over at the SNAP's office, Linda Charest, will be giving us an overview of Continuums of Care, or CoCs, and their importance for HUD Vash. Then we'll take a break from presentations, and the wonderful Teresa Pittman, HUD Vash Program Analyst and Regional Manager at the VA, will help us answer a few questions that you submit via the questions box. About the questions box, we may not get to all of your questions today. We may not be able to answer them verbally or probably not written out in the questions box, but we will receive a log of all questions and we can respond to them after the webinar. So after the questions section, then comes the part that I'm the most excited about for this webinar. I got to be honest. We will hear from 3 awesome HUD Vash teams that will discuss some of the changes, some of the big changes they have made to their programs in the last few months: Atlanta, Houston, and New Orleans. They will be discussing these changes and how improved collaboration with key community stakeholders and organizations has made a huge difference. We'll then finish off the webinar with another question segment facilitated by Teresa Pittman. So, next slide, please. Nancy Campbell will start us off with an overview.
Hello, everyone. I'm really very pleased to be on this call with all of you today to talk about the importance of community partnerships and collaborations in getting chronically homeless veterans housed through the HUD Vash program in order to reach our ultimate goal of ending veteran homelessness by 2015. First slide, please. On this slide is a schematic depiction of all the various components that are essential to the success of the 5-year plan. Hopefully most of you are familiar with this. It's a little busy, but I would like to just note a few highlights. Throughout the plan, as you can see, are references to community partnerships on all levels. At the top you see the federal partners, that's VA, HUD, Department of Labor, Department of Defense, Department of Justice. And there's also all these collaborations within VA. On the left side, you can see the Veteran Benefits Administration, vet centers, and even the National Cemetery Service has a role to play. And then you see in the center, which are the VA medical centers and the integrated networks, or VISNs as we call them. Please note that in the center of this diagram, where we have these local plans, community partnerships and collaborations are really key. And also note that it's not just communication from top down, but from bottom up, and also back and forth between all these different individuals that are playing a part in this plan. While there's national guidance and oversight pertaining to the programs and progress, we at the federal level are constantly learning about issues and barriers from the field. And we really are quite interested in working with individual communities and addressing concerns and supporting efforts, because the most important thing in noting all of this is that we all are in this together. Next slide, please. One of the directional changes made in recent years has been a rapid expansion of permanent supportive housing to supplement transitional beds such as those of the Grant Per Diem program and contract homeless veterans residential programs. The strategy includes an expansion of vouchers and beds and efforts to create new housing resources in the community, and also to better connect with the community in providing the supportive services that are so essential in helping veterans and families secure housing and to ensure that they stabilize and are able to sustain their housing placements. For veterans that are chronically homeless, such supports are really essential, and therefore it's quite important for us to collaborate with the community to do the kinds of things that VA is not able to do. And some of those things are providing assistance with deposits or utilities or other move-in expenses, or providing household goods and furnishings or transportation or legal services. Even though we now have close to 2,000 VA case managers, they aren't able to do it all. There's gaps in the need for us to rely on the community for assistance. Next slide, please. When we talk about permanent supportive housing, and can you go back one slide? Thank you. We're talking about two broad types of permanent supportive housing. The model that VA used to follow was a treatment first model, where it was kind of a linear, sequential process to get from treatment into housing. And by that I mean that there was expectations that, you know, if veterans had substance use or mental health issues, that they would deal with them first before they could get into housing. But we saw that this wasn't working. And also the community was demonstrating that by adopting a low-demand approach, such as housing first, that there was really great success in engaging chronically homeless individuals, and also great success in sustaining such individuals in housing. So this has now become the approach embraced by VA and being infused throughout the HUD Vash program. Get these individuals who are chronically homeless off the street first, and then talk to them about recovery goals and support them in determining for themselves what it is that is important to them as they move forward in their lives. Among the nationally implemented VA homeless programs, HUD Vash currently enrolls the largest number and percentage of chronically homeless, and it is a primary intervention to end homelessness amongst this most compromised groups of veterans. There are a lot of other homeless programs serving our veterans, and you can learn more about that by going to our website, www.va.gov/homeless, to learn more about them. But this is a very targeted intervention for this group that really needs that intensive case management that isn't available in some of our other programs. Next slide, please. There are a number of joint federal actions being taken to better target and house this group of chronically homeless veterans. Within VA, we have set a target goal that 65% of the individuals being accepted into HUD Vash meet the definition of chronically homeless. And we now have a new homeless registry data cube that allows sites to better self-monitor. And this is data that we can share with the community as to how we're doing in this regard. We also have adopted much more widely the use of vulnerability index in our screening process. So, you know, as we get referrals, we really look for those individuals who are most in need of this program because they are so vulnerable. We're doing an ongoing review of those that we currently serve, and this is information we have been sharing with HUD. Not only do we serve chronically homeless, we see that we have a very high number of those, like I said, who are vulnerable, and we also serve some special target populations such as females, some of our newest veterans from OEF, OIF, those with dependents, and the disabled. In the past, when we didn't have as many programs as we currently do, sometimes HUD Vash was the only option available in a community to assist homeless veterans, but we've now expanded some of our options to more rapidly rehouse and hopefully prevent homelessness in the first place. Our Supportive Services for Veterans Family program is one of those new options. We currently have 151 community providers. The money we have been able to provide for this program has gone from $100 million to $300 million next year. So we're really hoping to hit more communities in the future so that we have this other tool in our arsenal that will enable us to get to zero. We, as I mentioned, have also been adopting the Housing First philosophy within HUD Vash. We have a 14-site pilot project that is now going national. It is the direction for all of HUD Vash. We also have been striving for closer cooperation with the Continuums of Care on defining, locating, and engaging the chronically homeless, and in the process also trying to do some education about VA eligibility criteria. Unfortunately, not every chronically homeless veteran identified by the community meets our own VA eligibility criteria, and so then we need to look to the community for help on housing those veterans who really need the help, but for various reasons, such as not having honorable discharge or not having sufficient time in service, they really are not eligible for VA health care and consequently not eligible for HUD Vash. We also have been working very closely with the Community Solutions and their 100,000 Homes campaign and our own VA outreach staff to better identify those out on the street. And lastly, we have engaged with HUD and USICH, Community Solutions, and the Rapid Results Institute on holding regional boot camps that to date have successfully engaged 17 high-profile communities on looking at ways we can better identify these chronically homeless individuals and to get them housed much more rapidly. Next slide. This is some pictures from one of our boot camps in San Diego, and as you can see, it was a very fun and interactive, very lively engagement of folks not only from the national level but from the community level, people who day in and day out are working hard to find better, smarter, and faster ways of housing chronically homeless. In a few minutes, you're going to hear about some of the impressive results achieved by 3 of these communities, where really the key component in their success was pulling in all the key community stakeholders who regularly met and worked together to find, like I say, better ways of getting this done. We hope that at the end of this conference, you're going to go away with some ideas and some thoughts about how your community can work together even more closely in partnership to end veteran homelessness. Thank you.
This is Ann Oliva. I am the Office Director for the Office of Special Needs Assistance Programs here at HUD. I'm also the Acting Deputy Assistant Secretary for Special Needs Programs. And the reason that I am on this call today is because the Office of Special Needs Assistance Programs works very closely, as Kate mentioned earlier, with the Office of Public and Indian Housing. Primarily our role is to ensure that the allocation of the vouchers is done in concert with both the VA and with PIH, but it's also done in a way that reflects the data that we receive in our point-in-time count. I'm going to take a moment to talk about the definition of chronic homelessness, why we use it, and what a little bit of the history is around it. The homeless programs, no, that's fine. The homeless programs both can I have one slide back, please, John? Thank you. Let me start over again. So I want to talk a little bit about the definition of chronic homelessness, why we use it, and what the history is. Both in HUD Vash and in all of our other dedicated homeless programs, we really have done a lot of work to target the chronically homeless. So I think it's important for our grantees, for the folks who are running HUD Vash programs, to understand a little bit of the legislative and research history around the issue of chronic homelessness. And before I walk through the actual definition, let me give you a little bit of that background. The University of Pennsylvania, mostly the work of, reflecting the work of Dr. Dennis Culhane, back in the 90s, in 1999, I believe, really started looking at the homeless population and the nature of the homeless population, and found that about 80% of the homeless population were short stayers. About 10% were episodic, and 10% were chronically homeless, meaning that they were heavy users of the system. And that initial research really pointed out that 10% of persons who were chronically homeless used about 50% of the shelter resources within any given homeless services system. I used to be with the Continuum of Care in Washington, D.C., and after that research came out, we actually took a look at our own emergency shelter data, and our local emergency shelter data was very consistent with those findings. So in response to that research that showed that heavy users of the system really took a lot of the resources, additional research was done that really looked at the cost. And there's a slide at the end of my presentation that talks a little bit more about this, but I think it's important to realize that the people who are chronically homeless really were using had accumulated around $40,000 per year in public service use, whether that was emergency shelter stays, hospital stays, mental health, inpatient hospitalization. And it would take less money for us to permanently house these folks and then free up resources for other people who were experiencing homelessness. Congress actually noticed this research and started to add into HUD's appropriation report every year requirements and encouragement to fund programs for people who are chronically homeless. And we started doing that in conjunction with the U.S. Interagency Council on Homelessness, and in addition to our own initiatives. For those of you who are Continuum of Care grantees, you might remember something that we called the Samaritan Bonus Project. The Samaritan Bonus Projects were new funding that were dedicated 100% to people who are chronically homeless. We also did cross-agency projects with Health and Human Services to fund projects and resources for people who are chronically homeless. And in part due to the focus, the policy focus on this particular population, we've been able to decrease the number of people who are chronically homeless across this country. And what that says to HUD is, and to our federal partners, is that a federal focus on a specific population can really have an effect. And it's one of the reasons that we felt confident with the VA to take on the issue of veterans homelessness and to be able to end veterans homelessness within 5 years, or by 2015, which is our goal at this point. So right now I'm going to walk you through the actual definition of chronic homelessness as it is currently written in our statute. That is the McKinney-Vento Act statute. And chronic homelessness has two main components. It's the length of time somebody has been homeless and their disability status. So here on this slide, you can see that an individual, the definition is an individual who is homeless and lives in a place not meant for human habitation, which would be on the street, or in an emergency shelter, or what we would call a safe haven, which is a form of emergency shelter. And that person has been homeless for at least 1 year, or at least 4 times in the last 3 years. So you can see with this definition we are getting at people who are literally on the streets or in shelters and who have been there for a long time. The third component there on the screen is about disability status. So this person has to have been homeless for a long time and is literally homeless on the streets, but also suffers from substance abuse disorder, mental illness, developmental disability, PTSD, other types of disabling conditions. Can you go to the next slide, please? So now we've established that it has to be folks who have been homeless for a long time and who have disabilities that really are, in most cases, the cause of them having been on the streets for this long. We also have made some accommodations through the law and through our regulation for folks who have been in an institutional care facility, recognizing that people who are chronically homeless often are folks who are coming in and out of jails, who are coming out of substance abuse or mental health facilities. So the way we operationalize that is if somebody has been in one of those types of facilities for fewer than 90 days and was chronically homeless before entering that facility, then they meet the definition of chronically homeless coming out of that facility. And let me just explain the 90-day rule a little bit. The 90 days is really the line that we've drawn. If somebody is in a facility for less than 90 days and was chronically homeless going in, we really feel that the discharge planning is in part the responsibility of the homeless services system. Beyond 90 days, then they really have been in an institutional setting, and the discharge planning for that person really should be the responsibility of whatever institution they're coming out of. So if it's the case of a jail and somebody has been in jail for 2 years, because they were chronically homeless coming in doesn't mean that the jail itself or the prison should not be responsible for properly doing proper discharge planning for that individual. I hope that makes sense to folks. And then last but not least, the next slide, please, is how we work with families. The HEARTH Act actually gave us a new definition of chronic homelessness that specifically relates to families, and it can apply to families in specific cases, and that is a family with an adult head of household or a minor head of household if there's no adult who meets the definition of chronically homeless that I just described to you, including a family whose composition has fluctuated while the head of household has been homeless. So we can do, for families where an adult head of household meets the definition of chronic homelessness, we can do reunification with their children or reunification with their parents. So it gives us a little bit of flexibility to be able to work with families who have been homeless for a long duration and who are also disabled. So why are we doing this? Next slide, please. We know that serving this particular population is challenging, but at the end of the day, we also know that we will never end street homelessness if we do not end homelessness for this particular group. So it's the right thing to do for those of us who are homeless service providers at our core, which I am. We know that it's the right thing to do. It is not okay to pass over somebody who's been on the streets for years and has a tough disabling condition in favor of somebody that's easier to serve. And like I mentioned earlier, in the long run, we know that a focused effort on this particular population has made an impact on this population. We've been able to decrease the number of people who are chronically homeless on our streets since we started working on this in 2005. I also want to just raise that about, if 80% of people are really advocating for themselves and are leaving homelessness on their own, and about 20% need some additional outreach in order to get services. These are not the folks in general who are coming to the VA Medical Center for services that are advocating on their own behalf. So it is incumbent upon us as homeless service providers to ensure that we are doing outreach to that population. And obviously, we know that we can reuse those kinds of resources. If we can get these folks off the street and free up 50% of the resources, those resources can be used for other folks. And then my last slide is something that I already talked about, and you all can read about on your own, and that is that we're literally saving lives. The mortality rate for people who are chronically homeless is 4 to 9 times higher than the general population. It makes financial sense, and there's lots and lots of places around the country that have demonstrated how much sense this makes, and there's a link here for Project 50 in Los Angeles that is a good demonstration of why we should prioritize this population. So with that overview on chronic homelessness, I'm going to turn it over to Linda Charest from my staff, who is going to talk to you about what Continuums of Care are. Linda?
Thank you, Anne, and thank you, Caitlin, for inviting me to discuss the Continuum of Care and why it's so important to coordinate with the CoC during HUD Vash implementation. By way of introduction, I wanted you to know that I am a retired Marine and that helping homeless vets is a passion of mine. I've worked in the SNAP's office and with homeless assistance programs almost since arriving at HUD a little more than 12 years ago. I'm somewhat new but very excited to be part of the HUD Vash program because we all share the same goal, and that's helping homeless vets. So let's get started with the next slide, please. And again. All right, now I have 2 primary goals for today's discussion. Number 1 is to explain what a CoC is and what it does. And number 2 is to explain why including CoCs in your HUD Vash planning is critically important. As you'll hear later in the seminar, including local CoC organizations as key partners in the implementation of HUD Vash has been extremely important for the VAMCs and the PHAs that are successful in quickly housing chronically homeless veterans. Next slide, please. To provide a little background, let's start with the statute that authorizes this whole process. Authorized by the McKinney-Vento Homeless Assistance Act, HUD has provided homeless assistance funding for many, many years. HUD has administered these programs through CoCs. The Homeless Emergency Assistance and Rapid Transition to Housing Act of 2009, the HARTH Act, amended the McKinney-Vento Homeless Assistance Act. The HARTH Act codifies into law the continuum of care and the year-round planning requirements that have long been encouraged as part of HUD's annual competitive application for funding to assist homeless persons. Next slide, please. What is a continuum of care? Up on the screen is a pretty good definition. We've all heard the saying, it takes a village. For local communities, in order to help the homeless in the most efficient way, it takes a group of people from various organizations to actually determine the size and nature of homeless persons in the community, to keep track of the housing and supportive services that are available to meet those needs, and to develop a plan to meet unmet needs of the homeless in that community. Now, since 1994, HUD has required each community to come together to submit a single comprehensive CoC application rather than allowing applications from individual providers in a community. Continuum planning efforts may be organized at a number of geographic levels, a city in the county, a county, the region, or the state. HUD's intent here is to create a structured progress to stimulate community-wide planning and coordination of homeless programs. Now that we know what a CoC is, let's talk about what it does. CoCs primarily, they operate under 3 things. They operate the CoC, they designate and operate the Homeless Management Information System, and they develop the plan. Operating a CoC involves things like calling for semi-annual meetings of the full membership, inviting new members, appointing committees, developing a governance charter, stuff like that. Operating a Homeless Management Information System, HMIS, involves designating one single HMIS for the CoC. That's very important. Select an eligible applicant to manage that HMIS. Monitor recipient and sub-recipient participation in the HMIS, and review and approve privacy, security, and data quality plans. And of course, developing a plan means coordinating the implementation of a housing and service system within its geographic area, conducting that point-in-time count of homeless persons, and conducting the annual gaps analysis. Next slide, please. So next slide, please. While they're getting the slide up, let's talk about who participates in a CoC. There's nonprofit homeless providers, victim service providers, faith-based. You'll notice, can I please have the next slide? Yeah. Well, when you see the slide, you'll notice that community stakeholders in the CoC process include government agencies like HUD, the VA and its medical centers, public housing agencies that actually issue the HUD Vash vouchers. These folks have always been included as stakeholders in CoCs, but what's new in the past couple of years is the unprecedented coordination between all of us, HUD, the VA, the Interagency Council on Homelessness. Next slide, please. Why should HUD Vash partners participate in and collaborate with the CoC? That's goal number 2. CoCs should include the local VA medical clinics and PHAs in their membership and coordinate the planning for the homeless housing needs for chronically homeless and other homeless veterans. Through the HMIS, CoCs know how many permanent supportive housing units currently exist and the gap between what the communities have excuse me, and what they need to fill the gap. CoCs can then identify whether a community should submit an application that includes permanent housing projects. Because the CoCs actually go out and do that point-in-time count, they can assist the local Veterans Medical Center by identifying the most vulnerable veterans, those who are chronically homeless, and refer them to the VA. Case managers in the CoC can assist in providing referrals to mainstream and other supportive services and refer homeless veterans with less need for clinical and supportive services to other homeless housing projects. Thank you very much. That's all I have. Back to you, Kate.
Great. Thanks, Linda. And now we have Teresa Pittman. You have one question, I think, that we have time to address. Teresa? Okay. So first of all, I just want to apologize for the delay in slides. And I'm not hearing Teresa speak up. So I'm going to go ahead and pick one of our questions here. And I'm going to pick the one, let's see here. Not the relationship one. No? Okay. So one is, and Ann and Linda are helping me out here. One question that came in is, how do I go about building a relationship so that we can help those who are homeless? We are HUD subsidy with 4 vacancies currently.
So this is, I'll take the first crack at that. This is Ann Oliva from the staff's office. I think it's going to become more and more important as resources become tighter for all of our communities to ensure that you're working together to bring all the resources that you possibly can to bear. So if there's an agency out there that has 4 vacancies, whether they're HUD Vash vacancies or a regular homeless project, I would say reach out to your Continuum of Care leadership first to see if there's a stream of folks that can be referred to your project. I would also reach out to your local VA medical center. They have veterans who they're serving all the time who need permanent supportive housing. That doesn't necessarily have to be HUD Vash. It could be another type of permanent supportive housing project. So I think that those are 2 places that an agency that has openings could very easily go to and find folks to get into your housing. The third thing that I would encourage folks to do is to find out who's doing street outreach in your community. It could be a nonprofit organization. It might be your local government. It might actually also be the VA. And hook up with them because they have folks who they're working with on the street who are chronically homeless who can very easily be placed into these types of housing resources. So hopefully that helps the person who asked that question. And I think I'm going to turn it back to Kate.
Great. Thank you very much, Ann. And now it's time for the best part of our webinar when we hear about the success stories of 3 communities with large HUD Vash allocations, Atlanta, Houston, and New Orleans. We'll start with the awesome story of the Atlanta program. So Atlanta folks, you ready to take it away?
We are. Thanks, Caitlin. This is Emily Lee. Thank you so much for having us. We're really happy to be here today. I work in the Office of Mayor Kasim Reed as part of an innovation delivery team. We've been charged with developing innovative solutions to 2 of our mayor's highest priority issues. One is improving the city's customer service. The second is reducing street homelessness in Atlanta. We're funded by a grant from Bloomberg Philanthropies for $3.3 million that funds our team for 2 years. And so we have been charged with producing dramatic results on street homelessness in Atlanta by December of 2013. And so as a result of this, we have gone out into the community looking for opportunities to partner and identified the HUD Vash program as one of the biggest opportunities we could have for having a dramatic impact on street homelessness in Atlanta. So as the mayor's office, our role has really been to help bring all the government and community partners to the table to start a conversation and facilitate the process of setting common goals that we can work around, and then fine-tuning our process for working together to focus on the most chronic individuals on the street. The 100,000 Homes campaign and the 100-Day Challenge, which we participated in, was a great catalyst for that, helping us to bring us all together to set a manageable 100-day goal. And we're looking forward to continuing to work together and bring more members of the community into this process. So at this point, I'm going to turn it over to my team, who are the ones who are really doing the work. We have Viola Green and Jennifer Turner-Reed from our VA. We have Janice Stewart and Raquel Hawley from the Housing Authority of DeKalb County. Margaret Schulke from Project Community Connections, which has been one of our important nonprofit partners in this process. And we have many others involved in the collaboration, but this is who we have here today. So at this point, I'm going to turn it over to Iola Green to talk about things from the VA perspective. Raquel Hawley will be sharing the Housing Authority perspective, and I'll talk a little more about collaboration.
Thank you, Emily.
So next slide.
This is Viola Green from the Atlanta VA Medical Center. I'm the HUD Vash supervisor here. And just to kind of give you a little bit of history, in January 2011, the point-in-time count included about 4,900 individuals that were unsheltered or in emergency housing. 1,200 of these were veterans, including approximately 400 chronically homeless veterans. We find that only 38% of these chronically homeless veterans access the VA services as a result of a survey conducted by Clark Atlanta University. Today, the Atlanta HUD Vash program has a total of 1,140 vouchers. We work with 7 public housing authorities throughout the Atlanta area. As of 9/11, we have leased up 906 veterans, including 148 that are chronically homeless, who were leased up between May 15th and September 1st. During that period, from May 15th to September 1st, we had a goal of increasing our lease up as well as targeting the chronically homeless veterans. We were able to shorten our process from 166 days to 113 days. We were also able to increase the number of chronically homeless veterans we serve from 93% compared to 26% of those leased up prior to the May 15th date. Next slide. Some of the things that we found that went was going well in our HUD Vash program is that we were indeed receiving referrals from the Continuum of Care as well as from within the VA and other outside community agencies. Here, all the homeless program is located in one area, so we were able to use our triage to serve as a single port of entry for all our homeless veterans. We also began to work closely with our Granting Per Diem program as well as the transitional housing program. We have 282 treatment beds here in Atlanta. October 2011, there was a new VA performance measure that basically said that we needed to allocate vouchers to the most vulnerable or the chronically homeless veterans, and we began to meet that goal immediately. We instituted a housing fair the first time last year, and we continue to follow that as a best practice. The VA also began to develop relationships with a few of the housing advocates and placement specialists in the community that had a network of landlords and property owners. This allowed us to be able to connect our chronically homeless veterans with landlords in a more effective manner. And we, of course, use our Stand Down and Challenge Forum as an effort to engage our community partners. Next slide, please. One of the things we found in the Atlanta VA, some of the challenges, was just being able to find the most vulnerable clients, particularly those sleeping in unsheltered locations. We also, one of the other challenges was just being able to have landlords who were willing to accept individuals with criminal backgrounds as well as questionable credit backgrounds. There was a lack of resources for our homeless veterans during the housing search. Some of them didn't have means of getting to the homeless program because of funds mainly, or didn't have transportation to get out. We also, our case managers continue to carry a high caseload as we shift to the chronic, which challenged some of our case managers to assist the veterans in navigating the system. And now here in Atlanta, we had 5 PHAs that we were working with, so that proved to be somewhat of a challenge as well as not being able to have housing options in neighborhoods where our veterans could access transportation, basic services, as well as employment. And then our lack of funding for our veterans to move in or to pay utilities. And then one of the other challenges was the lack of consistent data between the VA as well as the PHAs. But today that's being resolved through weekly communications with our PHAs. At this time, I'd like to turn this over to Raquel, who is in our DeKalb Public Housing Authority.
Next slide, please. Hello. Today I'll be talking about the challenges that PHAs face in serving the chronically homeless through the HUD Vash program. Currently in this 5 PHAs administered Vash in Atlanta, we noticed the 2 issues that were challenges. There was the overall vouchers as well as the portability process throughout the city. Different PHAs have different portability processes, so therefore we need to get together to streamline one process for Vash vouchers. Another challenge that we noticed was the data status of the vouchers are inconsistent across 3 areas, PHAs, HUD, and the VA. We are streamlining a process as well to get one system database to track all issues for the veterans. Another issue we had with the VASH voucher program is dealing with the chronically homeless population in regards to contacting the veterans. Being that they are homeless, we found a difficulty locating them to call them in for their recertification appointments and or briefing and eligibility appointments. Another issue that we also found was verifying the income and the disabilities of the veterans. Another issue we noticed through this process are the landlords being able to provide them information timely. We noticed that there was a delay in getting them to provide the information when requested in order to house the veterans timely. Another issue is not having the units ready at the time of the initial inspection. We are trying to get the veterans housed within 60 days, so we do prefer that the landlords have the units ready to inspect so we can get the veterans housed. I will pass this over to Emily. Next slide, please.
Thanks. So as I mentioned, we've been working with all of our government and community partners to help identify opportunities for increasing coordination. And that really started with the 100,000 Homes Boot Camp, where we mapped out our HUD Vash process and started developing strategies for streamlining that. Following the boot camp, we started having weekly meetings with all of our partners, which really helped to facilitate and jumpstart that coordination. And we continue to work on how we can institutionalize that process, so we don't necessarily need to have a weekly meeting so everyone's on the same page. Following the boot camp, also brought all of our housing authorities together to map out their process and see where the variations were and where opportunities were for streamlining that. A few other successful strategies we identified were someone at HUD helped us create a HUD Vash directory that has the point of contact for every coordinating agency, and that's a Google Doc, so anyone can go in and update it as staff turnover occurs, which is one of the challenges that came up in our meetings. We've also worked to raise funds for providing some move-in assistance to clients, which is typically a moderate level of assistance that's needed, and that can really help overcome that final barrier to get people into housing. And we worked with a really wonderful third-party provider, Project Community Connections Incorporated, and we'll talk a little more about them in a moment. Some of the things that on our agenda for the next several months that we'll be working on, coming up with a data sharing agreement with the housing authorities and the VA. We are going to work on the outreach process. We are planning to conduct a registry week in January of next year, working with our CoC and our HMIS provider. We're going to be looking at opportunities to expand housing stock through landlord outreach and looking for opportunities for project-based vouchers. We're also going to be looking at housing retention and how we can partner with other service providers. Finally, we'll also be folding in the SSVS providers to this process. So I'm going to turn it back over to Raquel to talk about some of the strategies that the housing authorities are working on.
Next slide, please.
In 2012, the PHAs are currently partnering with the VA as well as community partners to improve the ability of the program to serve the veterans. We will be meeting regularly to ensure close coordination of the vouchers applicants and the leasing up process. Additionally, in the meeting, we will try to figure out and map out new processes and identify any barriers and workarounds that we can do as a housing authority to assist the VA in housing the veterans timely. We have implemented several best practices, but in particular four, and that's the PHA now accepting the DD-214 and the VA ID in lieu of a birth certificate or Social Security card. Additionally, we are inviting landlords to voucher briefings, as well as educating the VA case managers on the requirements of housing from the lease up, from the eligibility portion to the lease up. We also will be sending the VA weekly status updates on the veterans process individually. Next slide, please. Back to Emily.
And I don't know if there seems to be we're having some technical issues here in Atlanta, so I don't know if these slides are actually forwarding with us. But we're going to keep moving forward unless someone stops us. In the interest of time, Margaret Schulke asked me to speak just briefly to how her organization, Project Community Connections Incorporated, has helped bridge some of the gaps in serving the chronically homeless with VASH. They have a network of property management company relationships and landlord relationships that they've helped to leverage. They do housing assessments with clients to understand their barriers and help develop strategies to move them into housing as quickly as possible and help navigate this process, working closely with the VA to see where the case managers need that extra third-party assistance. They have also been our administrator for the move-in funding, and they've helped streamline a process coordinating with the VA to administer that funding in a really timely manner so that people can move into housing as quickly as they find a place. We can get them moved in quickly. They are also going to be one of our SSVS partners, so we'll be working closely with them on providing services to VASH clients once they're in housing, to keep them in housing, and also identifying other veterans who may not qualify for VASH that we can assist with shorter-term rental subsidies. And I'm going to turn it back over now to Iola to go over some of our recommended best practices. Next slide, please.
So our recommended best practices include partnering with outreach workers to connect with our veterans for temporary beds once they've been referred. And this will include using United Way that have temporary beds, and they've been able to step up to serve this need. And we were going to continue to engage third-party providers and helping us to bridge the gap during the housing search for our chronically homeless veterans by providing transportation to visit the housing and perhaps administering move-in assistance funding. Our meetings will continue with the PHAs as well as the rest of the team so that we can ensure that close collaboration and clarity is identified when it comes to the requirement for the chronically homeless veterans. We did hold a housing fair again in June, and we'll continue to hold fairs. As a matter of fact, we plan one for our stand down on October 20th. We have been holding a case manager competition that motivated our case managers to facilitate this cultural shift to focus more on the chronic population. Next slide, please. And as you can see, there's a copy of our housing fair announcement that was held in June, and you see the Tattoo Team Wednesday. That was the week that they won the competition for leasing up the most veterans in 1 week. Next slide, please. And of course, we have our Royal Team Friday, and what better way to end Atlanta's presentation to show that we are royally doing rocking and rolling here in Atlanta, Georgia. Thank you.
Thank you, Atlanta team. Very exciting what you guys have achieved. Now we will be moving on to the Houston team. And Houston, just a reminder that you have just 12 minutes for your presentation. We're running a little bit behind here. So Houston, take it away.
Oh, great. And I'm a long talker. So we really love Atlanta's pictures because I think they exemplify how you come together to accomplish a tremendously difficult goal. Collaboration is the key, and the housing authorities have to think differently. Next slide. We have, like Atlanta did, several folks here who are representing different agencies. Takesha Plowden from the VA, Roxanne Henry from Harris County Community Services Department, and Curtis Wilson representing the Coalition for the Homeless of Houston and Harris County, and essentially representing the CoC. So we'll see when this pops up. Data drives the picture from the beginning. Currently we have 1,045 VASH vouchers allocated to Houston, Harris County, 795 at HHA, 250 at HCHA, with 35 VA case managers. We've leased 930 of that 1045. We're at 89% leased for the universe, and of course we've leased everything pre-2012 and are in our 2012 lease-up. Our point-in-time count indicated a higher number, 7,356 homeless individuals, of whom 22% were veterans, 1,618. Like the national good news on veteran homelessness, Harris County homeless population decreased 13.8% from 2011 to 2012, and it's got to if we're going to make our national goal of eliminating veteran homelessness by 2015. So we really did set, next slide, an aggressive goal. Our demonstration was to house 100 chronically homeless Houstonians, at least 60 of whom are veterans, in 100 days, meaning we understood at the Housing Authority that we needed to think differently about partnerships and about who we house. So, you know, when we're looking here at Farrell Wright and Deborah Hill, this is from a camp in Houston, and they were some of the non-VASH eligible chronically homeless who were also issued vouchers during this period. The goal was 100 and 100. Next slide, please. And so the question was, how did we do? And like I said, we're really data-driven. So what you begin to see is, as we track RAPTA to leased, we're talking about 20 days, voucher issuance to leased, the whole process, 44 days. 24 days, the veteran has that voucher in their hand searching. It's 8 days from RAPTA to pass, and as Atlanta indicated, that's a fail every time. So we schedule, the unit fails, they fix it, we go out again in 8 days. Pass to lease is 12 days, which could be shorter if we could get our landlords to let go of those contracts. They basically feel like once they got a contract, they're going to get paid. What's the rush? And of course, we're calling and sending folks out to collect those. Chronic universe by status, we did issue to 160 during the demonstration period, at least 101 chronically homeless veterans in 100 days. Total VASH issued, we issued to folks who weren't chronic, and this goes to the percentages. What we're trying to do is hit that 65% chronic. So you see that we hit 64% of issued during the demonstration were to chronically homeless, and 68% of the leased were chronic homeless leased. And pre the demonstration program, we were only doing for January to May 2012, we're only doing 22%. So it's really a radically different way of focusing it. So next slide, please. Takesha, tell me a little bit about what was it before? What was it like before we changed how we're doing things?
Well, prior to going into the boot camp and the 100-100 project that we did here, we were operating independently. The VA, we were utilizing many of our community partners, but I don't feel that we were utilizing them to the best of our ability. The thing that really helped us to be successful here was to charge ourselves with thinking differently and doing better. Collectively, together we can be far more successful than we could do independently. Again, we weren't tracking the data. There wasn't one method of tracking the data, and various systemic barriers similar to Atlanta, with our veterans having criminal backgrounds, unstable incomes, and things of that nature. Those were issues that we had to address. We also had to come to a consensus of the definition of chronically homeless to streamline our ability to use the same information that our veterans were presenting to secure services with the VA as well as our community partners. And within the PHA system, we also had to address the timely use of the vouchers that were issued to our veterans. We didn't want our vouchers to expire, and we wanted those to be applied to units that our veterans would be proud to reside in. Next slide. The boot camp was able to identify and actually provide us, the professionals, with a visual picture of the systematic issues that our veterans were experiencing. From coming to the VA and expressing that they were not in stable housing, imminent risk of housing, or actually living on the street, to receiving their voucher and actually being leased up and moving into their unit, we wanted to significantly decrease the time that our veterans experience from, presenting with homelessness and leasing up. One of the things that we were able to do to accomplish our overall goal was to utilize our mass briefing with the PHA, community partners, and the VA present. We were able to have our VA regional office present, which was able to provide documentation of eligibility to our veterans. The police department was also present, able to provide documentation to who the veterans actually were, on-site criminal background checks. The VA was present, assisted the veterans with communicating or completing paperwork and things of that nature. And just having all of our community partners there, especially our partners that had SSVF funding, to offer our veterans assistance with utility deposits, rental deposits, was very instrumental into speeding up that process. We also was able to enter the veterans' information into HMIS on-site at our mass screenings, as well as before and after, and our community partners were very instrumental in doing that. Now, within the VA, our HUD Vash case managers were trained in the CTI model, the critical time intervention model, which really helped us to utilize our skills in treating or in working with our veterans who were chronically homeless. We are working to decrease the caseload size, but utilizing the CPI model really helps us into servicing our veterans and the best and providing them with the best services possible. I'm going to turn it over to Mark Beaton.
Just real quickly, we changed the administrative plan. We did MOUs with our partners, the Housing Authority, and this is the sea change, committed to leasing 1,000 homeless individuals over the next 4 years, which means administrative plan changes with the thinking at the board level, requested waivers, and created a variety of positions. If we go to the next slide, we have one of our partners here from Harris County CSD to talk a little bit about their role in this project.
Hi, good afternoon, audience. My name is Roxanne Henry. I serve as a social worker and an administrator with the Harris County Community Services Department. I'll be very brief due to time constraints, but today I'm going to talk about our role with the project and the partnership in terms of providing rapid rehousing, and also stress and highlight some of the things that went on with regards to collaboration. When we first entered into this partnership with the VA and the Housing Authority, we understood the importance of this project, we understood the time constraints of the project, and we understood that change needed to happen, and it needed to happen fairly quickly, but in a very productive and positive way. With that, we were able to dedicate 5 case managers and 1 administrative assistant to specifically work on this project to ensure that we were able to provide rapid rehousing within a 30-day turnaround. We had, through the use of our HUD HPRP funding, we were able to provide rapid rehousing and to place 23 VAS veterans into hotels. Now, for anyone and for those out there that know about HPRP, you know that HPRP was going to end July 31st. So our goal was to work very closely, not only with the VA and the Housing Authority, but other community partners to ensure that we assisted with identifying units, making payments to hotels, and getting them into that identified unit within 30 days. Of the 23 that we placed in hotels, 17 have successfully been housed, and of the 17 using our rapid rehousing funding through HPRP, we were able to assist 12 veterans with security deposits and also 5 with utility deposits. In terms of collaboration, we know that here today speaking is the Housing Authority, the VA, and CSD, but also I did want to mention some of the other community partners that were very key to the success of this project, and that would be SEARCH, the Youth and Housing Corporation.
Next slide, please.
Career and Recovery Resources, USICH, and the Coalition for the Homeless. One of the things that USICH and SEARCH was able to provide during the mass briefing that Takesha with the VA spoke about was transportation from the mass briefing to the hotels in which the vets were placed. Also, USICH made sure that food was there and waiting for the veterans when they arrived to the hotel units where they were placed. Also, there was a lot of collaboration with the VA to make sure that not only that they were placed in the hotels, but once there, that transportation was made available to take them to identify and tour units. As you know, with this population, transportation is a big challenge and a big issue. So to be able to have transportation up and ready to take them to tour the property in Harris County, which has a lot of geographical challenges, was very key.
Next slide, please. I do want to real quickly put a shout out for Harris County Housing Authority, and we didn't have 5 like Atlanta, but we did have 2 involved, and tremendously important that the housing authorities are on the same page. You heard from Roxanne Henry. She's in the bottom left there working with her caseworkers from CSD. You heard from Takesha, who's right in the middle. We could barely ever catch Takesha on film because she's moving so fast with the VA. Next slide, please. We do have Curtis here to put a shout out on collaboration from the CoC.
Good day to everybody. Again, my name is Curtis Wilson with the Coalition for the Homeless. We are the lead agency for our Continuum of Care here for Houston and Harris County. Just to put a cap on everything, we are certainly ecstatic about the ability for us to have a huge team of agencies and organizations come together for this effort. You know, there's been a tremendous change in the approach of how we approach housing our homeless, especially our chronically homeless and our chronically homeless veterans, by having organizations like both housing authorities step up to the plate, in which we've not had in the past. But collaboration is obviously going to be a launching pad for us here in Houston and Harris County to do a lot more aggressive things here in our community. And we're so proud to have been a part of this effort. We're proud to have had such a number of agencies come together and really contribute what they had, whether it be funding, services, case management, what have you, in order to make this a success. I know all of us experienced some pains at some point in this process, but we were really able to show what collaboration can do in an effort to not only meet our goals, but we actually can say that we've exceeded our goal that we set out before us.
Next slide. Thank you, Curtis. Atlanta led with the mayor, and we'll finish with the mayor. You know, high-level community support is tremendously important, and we're grateful that Mayor Anise Parker welcomed 4 of our formerly homeless, chronically homeless veterans to their new home. Next slide. She made the point of saying that this ending homelessness is going to be a top priority for her, and it was a tremendously personal moment. You see Alvin Black in the middle. Next slide. Mayor Parker, there was at the end of her prepared remarks, and you can see them in the right. This is the picture that made the front page related to it. He asked her if he could take a picture with her, and it was a tremendously genuine moment when she, you know, gave him a hug, and they exchanged a few words. When you know that your community is together on an issue, you can do miracles, and we're absolutely clear that the sum is greater than each of the parts. So we thank you and move you on to Greater New Orleans. Got a great story to tell.
Thank you so much, Mark, and your Houston team. I just want to point out for both Atlanta and Houston how important it was to involve the mayor's office to kind of bring all the important stakeholders to the table to really build momentum and get things done. So I think that's awesome. So last but certainly very far from least, New Orleans.
Hello, this is Greater New Orleans. We're here making a difference. We're turning lives around. Together we stand the VA, HUD, Kenner Housing Authority of New Orleans, VOA, Unity, and the City of New Orleans. I'm Michelle Jonet, HUD Vash Case Manager in New Orleans. I have with me Melissa Haley from the VOA, Valerie Pruitt from the Housing Authority of New Orleans, and Ms. Tyra Brown, who's representing the City of New Orleans. As of today, we have 515 HUD Vash vouchers in the Greater New Orleans area, which is administered by 2 public housing authorities. We have the Kenner Housing Authority, which has 365 vouchers that they've been administering since 2008. We have the Housing Authority of New Orleans, which has 150 vouchers, which they have been administering since 2010. Here at the Southeast Louisiana Veterans Healthcare System, we work with both of the public housing authorities. We have 8 HUD Vash case managers. We're working to have each case manager have a caseload ratio of 30:1. We also in the process of hiring 3 additional case managers by the second quarter of fiscal year 2013. Next slide, please. Prior to the boot camp, Kenner Housing Authority was the sole administrator of 365 vouchers. They were high performers, which was working really well for them was that they maintained excellent relationships with the HUD Vash and the VA. Challenges that they were facing was that they had inaccurate housing lease-up data between the agencies. They had scattered appointments, but this had a lot to do with the bottleneck in documentation. They had limited housing stocks because we have a lack of 1-bedroom apartments here within Greater New Orleans.
the unit inspections for more than 30 days of the RFPAs. They had limited security and utility deposits assistance in order to help the veterans to be housed. We also had portability issues. A good thing that we had going before, that we keep having prior to the boot camp, is that we have our annual challenge meetings and monthly community meetings at the VA has with community providers. Next slide, please. Some major challenges that we have in serving the community homeless is that we had trouble locating and tracking the families. We had some trust issues where we had to work with helping the chronically homeless. The veterans had lack of documentation. They had a lack of financial independence, and it was hard for them to get the sustainability that they needed. Next slide, please. And I'm going to turn it over to VOA, Ms. Melissa Haley.
Good afternoon. When we began this journey at the Rapid Results meeting, we identified those challenges that Michelle just talked to you about, and we decided that we needed to, our number one goal was to house the 105 veterans who had vouchers in hand, but they had not leased up units. So we identified a process and procedures that would help us lease these 105 vouchers up within 100 days. So some of the things that we needed to do and ultimately accomplish was a one-day set-aside for voucher issuance, uniform application with the 2 public housing authorities in Kenner and in New Orleans. The DD-214 was accepted in lieu of a birth certificate and Social Security process. Hano had 100 vouchers, and because Kenner had been utilizing the vouchers since 2008, they adopted the best practices of Kenner, and as said earlier, they merged one application. Collaboration with the stakeholders is something that we're very proud of. We got together, HUD, the VA, the public housing authorities, the Continuum of Care Unity, and Volunteers of America, the SSVF provider, and the City of New Orleans. We did weekly data reconciliation between agencies. The housing authorities gave VA as well as Volunteers of America access to the Housing Choice Leak so we could help veterans find houses quicker. We reduced inspections with the help of the housing authorities to within 3 days. Next slide, please. So we got together, we decided that, you know, what are the best marriages that we can put together. So HUD Vash, of course, is already together, so we merged SSVF with that process. Of the 105 veterans who were holding vouchers, SSVF assisted 88 of those vouchers either via a housing search, security deposit. Volunteers of America is the SSVF recipient in our area. Special program specialist inspectors were hired just for the VASH voucher program. So in many cases, some vouchers and some inspections were done within 2 days. We partner with other public-private agencies to get furniture, and we'll talk about that in a minute. Next slide, please. Here's one of our veterans. He was super excited about his unit. As you can tell, the unit is very modern, and so we wanted to show you that it's really more, it's not about the numbers for us in New Orleans. We're a family environment. It's about the people that we come in contact every day, many of whom are our neighbors at some point throughout their lives. Next slide, please. So Volunteers of America, Greater New Orleans, we've committed to the follow-up with the SSVF families. We work towards sustainability. We utilize the but-for requirement that SSVF has, but for assistance through SSVF, the veteran will remain homeless. We maintain weekly communications. We had conference calls. Sometimes we got together. We were committed to staying in communication with one another, utilizing the inspectors as identified to expedite the process. We increased outreach. Volunteers of America, along with the VA outreach team, went with the City of New Orleans. We went under the bridges. We went out at night. We added case management hours to identify not only the chronic veterans, but those who were most homeless. We continue to educate the community on VASH and the streamlined process. The portability, Kenner is the area that you get to in New Orleans that's outside near the airport, but most people were trying to port to New Orleans or Baton Rouge, so the streamlining of that process made that much easier to do. We were able to identify a funder through the City of New Orleans who put a $10,000 seed to help us identify match money really to get donations for furniture for veterans. We were able to utilize SSVF funds for emergency kits and security deposits. Next slide, please. Our biggest work, what we were really proud at the end of the day, we actually issued more than 105 vouchers. We issued 121 lease-ups within 100 days. We were excited about that because really just in that very short period of time, we were able to change processes permanently and to permanently eliminate silos and to come together as one team, which we're proud of Team New Orleans. We're especially appreciative to the City of New Orleans to inviting the Continuums of Care to the table, as well as Volunteers of America of Greater New Orleans. 600 plus families were surveyed through the Registry Week. Everybody on our team went out for Registry Week, and it really gives you an opportunity to put names with faces to realize that this is more than just numbers, these are people. Of that 600 plus families who were identified during Registry Week, 57 of those were veterans. Volunteers of America through SSVF followed up with those veterans, trying to identify them and referring them to VA as needed. The HUD Vash Summit was held, and during the summit, each one of the agencies talked about resources available. We identified additional challenges so we can continue on throughout this process. We placed most vulnerable chronic homeless vouchers, and we did that because the Continuum of Care, they do have a matrix where we can identify which one of the most vulnerable in the chronic process, and we made sure that those were housed first. Next slide, please. So this is our work, and this is what we're proud of, and you'll see this again. And if it's okay, we'll go to the next slide as a result of time. The best practice and innovations, there was a one-day set-aside for same-day vouchers, so one day of the week is just for HUD Vash vouchers. We also developed a uniform application, so if you were porting from Kenner to New Orleans, the veteran did not have to do another application. That application, the only thing difference between the application is the box you check. You either check New Orleans or you check Kenner. That's the only thing that needs to be done differently. The acceptance of DD-214, which was critical because a lot of on-the-street veterans don't have IDs in hand, and they may have to often get them from Texas or Atlanta or other areas. So the DD-214 could verify the veteran status. We had weekly communications via conference call. Weekly we did data reconciliation so we could make sure that we were accomplishing the goal. There was an intervention for collaborative effort for portability and identifying additional resources. SSVF assisted 88 of the 121 veterans with security deposits, emergency moving funds. With those funds, you can also pay past due rent. You can also identify other areas that may be preventing a client from leasing up. We had a landlord leasing fair, so we could educate the landlords about the additional supports that the veterans get through SSVF, as well as through the HUD Vash case management staff. We also created a brochure so we can let the community know about the best practices and who they can contact in our community. Thank you.
Thank you so much, New Orleans. And I just want to emphasize that that what these teams have done is really awesome, and certainly the Rapid Results boot camps have served as sort of a catalyst for the teams to change their systems and improve their programs. But the boot camps are not a necessary component to initiate such changes. You may need an outside facilitator to help map out your processes, facilitate problem solving, etc. But it's definitely something that's achievable on your own. And if you need some ideas or inspiration about how to do so, Teresa, is it all right if we can post our email addresses, right? Are you okay with that? Sure. Okay. Can you hear me? Yeah. So we will post our email addresses. I think we can do that to everybody. Is that right, John? Well,
we'll get them posted. But
okay.
Yeah.
So we'll distribute our. So if you have any questions about doing some sort of boot camp or how you can do it, or suggestions about streamlining your programs, you can email Teresa or I, and we can help you with that. And so now we're going to answer some final questions. We'll take maybe, like 3 or 4 questions. Teresa, what do you think?
Yeah, I think we can get that far.
And again, and so we might go a little over on time, which is okay. And again, if we don't answer your questions verbally over the webinar, we will provide them via email, probably sending out answers to everyone. So, but again, you can also, we'll also provide our email addresses, and you can email us directly. So there's one question that's been common that I want to reply to right now, and that is whether or not the slides will be available for this presentation, and we will definitely send out the slides. And again, there will be a recording posted to both the HUD Vash website as well as HUD's HUD Vash website, and it might be posted, I think, on the VA's shared website, SharePoint site, I should say, and then it'll be posted probably on the HUD HRE website as well. So, Teresa, do you want to?
Sure. I want to answer first off this one question, which is, can you supply any VA HUD contacts that we may reach out to for disabled and homeless veterans? And what I want to do is give folks the National Call Center number. This is for homeless veterans, and that number is 1-877-424-3838 or 1-877-4-AID VET, V-E-T. So it's the same number. It's just one of them is 4-AID VET, and the other one is the numbers that are written out. So, and we'll send that as well with our information with the questions when we answer those. The first question is, can you please explain the case manager competition in more detail?
And that was for I believe the Atlanta team. Atlanta team, Iola, are you guys still on?
Yes, we are. The competition, I divided my teams up into 5 teams, Monday through Friday team. They were all given equal amount of staff on the team with a team leader. And the whole idea was whoever leased up the most veterans in 1 week, as a supervisor, I was able to give them 59 minutes off work. It began to be such a fantastic way of motivating them. So every week we had teams who, well, once they won, they came up with ideas on how that they could be creative in showing off their winning, you know, kind of strutting their stuff, so to speak. But as a supervisor in the VA, that is probably one of the least things that I could give them without having to go through other directors or supervisors in terms of rewarding our staff. And believe me, 59 minutes make a big difference on a Friday afternoon in Atlanta, Georgia, or a Monday morning.
Great. Thank you so much. The second question is, would someone explain how housing fairs work? How was it set up so that veterans and landlords meet? And were they approved for units, RAFTA, and inspections being scheduled on the same day? Just trying to really get a picture of how this all works.
Well, this is Iola Green again in Atlanta. Our first housing fair, we invited landlords who already had veterans in their units, and we also invited new landlords who were interested in becoming participant of the choice voucher. We actually, this last housing fair, we had them here at our homeless program, and we had it on a Saturday. So we had all our offices as apartment units, and we invited every veteran that had a voucher in hand that had not leased up to the housing fair. So as a result, the veterans kind of did a one-stop shopping just for apartments for that one day. We also had available 2 of the property owners that had their vans, who literally took the veterans in their vans to the site to literally see where they would be living. As a result, we had 101 veterans who showed up. Out of that 101, 11 veterans were able to turn in their RFTAs that same day.
It sounds like Houston did a slight variation on the same thing, although maybe it's what you did, which was at our mass briefings, we had the landlords there. We also had vehicles, and in some cases we had done pre-inspections. So there was basically a landlord hallway where after you were issued you could go, and the landlords here were very aggressive because there's a lot of vacancy in Houston. And so they had a variety of gifts for the veterans, and some of them brought veterans to draw them to their property. But we had over 20 landlords participate at each of our 3 mass briefings.
Great. Thank you. Caitlin, I'm not sure which question.
Okay, there was one question asked on how can we encourage, collaborate with agencies such as United Way to help veterans with move-in costs. And I was thinking that New Orleans would be a good, would be the team to respond to that one.
Actually, United Way is not a part of the continuum because they're not a direct service provider. However, what we did, we solicited a funder to help match the resources. But most, there was just, an award was just issued for SSVF. The majority of the communities, majority of states have SSVF available or will be available on October 1. I believe Atlanta was able to accomplish their goals without SSVF, but as of October 1, they will have access to SSVF. So what I would recommend is that you check the website to see who that provider is in your state, because come October 1st, they will be looking for veterans who meet the SSVF but-for requirements. So if there are veterans out there who have a voucher in hand and they need a security deposit, and the only thing that's stopping them from getting into housing is that they need a security deposit, that's exactly what those resources were designed to do.
Great. Do we have time for one more, or what do you think?
Yeah, sure. Or Atlanta or Houston, do you guys have anything to add about collaborating with agencies such as United Way? I mean, other agencies that don't necessarily administer SSVF.
Well, here in Atlanta, we've been working with a local community agency, PCCI, who actually came to the homeless program and interviewed those veterans who needed assistance with rent deposit as well as utilities. And then they make that payment directly to the landlord or to the utility company on behalf of the veteran. That was one of the ways that we were able to get our veterans leased up quickly. Some of the funds that the PCCI utilized came through the United Way as well as from the city of Atlanta. So that helped in our collaboration in terms of getting our veterans leased up quickly.
Great, thank you. Teresa, do you have, should we ask one more question?
Sure. I have one here that I think is an interesting question. How do we locate the continuum of care in our area?
Yep, Linda, she's on it.
Hi. There's a website, the HRE, www.hre.info, and if you look on there under resources, click on that button, and it'll give you the name and the point of contact for all the continuum of care systems nationwide. There was also a question about, well, I'm in Hudson, New Jersey. If you click on that, and how do I get in contact with a CoC, it'll list most of the continuum of care systems are actually named by their geographic area. So if you're in, I don't know which one that was. It was someplace in New Jersey, but you could just look at that and you can find the closest city, or you can find the county and call that person, and if you give them your address, they'll be sure to. The website is www.hre.info. I'm repeating the HUD HRE info.info. That's www.hudhre.info. HUD.info. How's that?
And we can include those when we set up the questions, the written ones that we send out, and make sure that that information is on that.
Great. Okay, do you think, are there any others, Teresa? We should probably close it up, right?
Probably should close it up.
Okay, and again, I'm sorry if we didn't get to your questions, but we will respond in a written document to you somehow. So I just want to thank all of our presenters and all of the amazing work that our teams from Houston, Atlanta, and New Orleans specifically are working on. And I also want to thank our moderator, John McGaugh, and his team, and I want to thank the SNAP's office for sponsoring this webinar, and to everyone listening in to this webinar and for your support of the HUD Vash program. We're all working super hard towards our goal of ending veterans' homelessness by 2015. There are many ways, however, to work faster and smarter, which is necessary if we're going to achieve our goal. If you haven't already, I urge you to organize some sort of community meeting with your local government officials, members of your Continuum of Care, and other stakeholders. Work together to coordinate, streamline, and set periodic short-term goals for housing homeless veterans. And then, what do you know, you might be the first team in the U.S. to actually end veteran homelessness in your community, which would be amazing, and it's so doable. So again, thanks to everybody. Thanks for everything that you're doing. And again, look for a recording of this webinar posted on the HUD Vash website. Tell your friends, and we'll be also posting the slides. So thanks again, everybody.